Hi there. How are you today? Wonderful. My name is Dr. Mad. I'm going to do your cranial nerve exam. Can I please verify your first and last name? Okay. And your date of birth, please. July 21st, 1988. Okay, perfect. Do you have any allergies? You don't? Okay, good. And are you taking any medications on a daily basis? You're taking metoprolol? Okay. How many milligrams of that? 500 milligrams? Okay. Oh, 5 milligrams. Yes, correct. And do you have any medical history? Hypertension? Okay. Great. Good to know. And let's see. Do you have any respiratory disorders like COPD, asthma, pulmonary edema, pulmonary hypertension? Okay. Okay, great. Good. And are you under the care of a neurologist? Okay, great. Let's see what else we have here. Any hospitalizations in the last 12 months that I should be aware of? Okay. So I do have here, I just wanted to make sure that I know about everything, yeah. So I do have here your information from Lutheran General. And they said that you went to the ER for a fall. Okay. And that was just last month, correct? Okay. Great. All right. And what kind of symptoms are you experiencing at the moment? Headaches, loss of smell, loss of taste. Okay. You can't feel your face. Is it the entire face or just one part? Just one part. Okay. Left side, down. Okay. Next to chin. And do you feel any twitching around the mouth? No. Good. Okay, well, it definitely sounds like you are in the right place. I'm gonna go ahead and do a cranial nerve exam. Are you having any pain right now? Okay. And on a scale of 0 to 10, how would you rate your pain? Okay. I'm gonna go ahead and take your temperature. This will go underneath your tongue. Give me just 1 second, please. Good. Okay. Oh, I believe this should go over here. Let's see, what did I do? Oh, on the outside. Okay. Can you please open your mouth and just hold it, good. Okay, 36.9 Celsius, which is perfectly normal. And I'm going to take your oxygenation. This will go on your index finger. Can I please have that? Good. So just go ahead and hold it and take a deep breath in and breathe out. Good. Take a deep breath in and breathe out. Perfect. So your oxygenation is 99 percentile on room air, which is perfectly normal. And your heart rate is 77 beats per minute. That's okay. I'm going to go ahead and listen to your heart. Okay. I'll put this on your chest right here. I apologize for the noise. We're not the only people in this office. So just go ahead and take a deep breath in and breathe out. Good. And take a deep breath in and breathe out. Good. Okay. And now listen to your heart. Just relax. Good. Okay. And I'll just move the stethoscope a little bit to the side. Again, relax. Okay, so I'm able to hear only S1 and S2, no S3, no S4. I'm gonna go ahead and just switch and listen with the bell to make sure that I'm hearing any murmurs. Good. And now I'm gonna go ahead and listen to your neck, okay? So can you please just lean forward a little bit? Lean forward, very good. Okay, and I'll listen to the other side, your jugular vein. Go ahead and lean forward, same thing, good. Now can you please take a deep breath in and hold it for 1, 2, and 3, good. And I'll do the same thing on the other side. Go ahead and lean forward. I'm gonna go ahead and ask you to take a deep breath in and hold it for 1, 2, and 3, good. Okay, so I could not hear any murmurs on your neck. That's perfect. I'm gonna go ahead and check your facial sensation, but first I'll go ahead and just tap on your bony prominences. Is that okay? Good. Go ahead and relax. Good. 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 Okay. And now I'll perform what's called a sharp or dull test. I'm going to ask you to extend your palm. Perfect. And I'm going to show you what sharp is. This is sharp. Good. And this is dull. Okay. So go ahead and close your eyes and tell me if it's sharp or dull. Dull. Good. Dull. Good. Sharp. Dull. Sharp. Dull. Dull. Sharp. Great. Okay. I'm gonna do the same thing. Tell me if it's sharp or dull, okay? Dull. Dull. Sharp. 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 Dull. Sharp. Perfect. Okay, now go ahead and close your eyes and tell me exactly where you feel this on your face. Left side, right side, left side, right side, left side, right side, good, left side, right side, good, left side, right side. Okay, perfect. Go ahead and check your taste. Okay, I'm gonna go ahead and place 1 drop on your tongue. It's gonna be very concentrated. Tell me if you can distinguish this taste. Tastes like lemons. Good. I'm gonna go ahead and give you 1 more. This one is gonna be a little bit salty, okay? What does it taste like? It tastes like pretzels. Perfect. Okay. I'm gonna go ahead and palpate your nose. Let me know if you feel any kind of pain. Good. I'm gonna ask you to take a deep breath in through your nose. I'm going to obstruct 1 ear. Take a deep breath in and out. Good. And same thing on the other side. Take a deep breath in and out. Okay, perfect. So both nares are patent. Now can you please close 1 nair? Good. And I'm gonna ask you to breathe in and out. And tell me what this smells like. Wonderful. Mint. Okay. And I have here 1 more. I'm going to ask you to switch nairs now. And go ahead and breathe in and out. Breathe in and out. Breathe in and out. Can you please distinguish that smell? Yeah, smells like cinnamon. Perfect. Okay. Let's go ahead and check your eyes next. Okay, I have here a light. I'm gonna go ahead and just flash it. Make sure that your pupils are round and reactive to light. Good. And accommodating as well. Okay, good. Good. I'm gonna do that one more time on the other side. Good. Okay, perfect. And now I'm gonna go ahead and check your optic nerve. Can you please look this way for me? Just look behind me. I'm gonna come very close and just check your pupil and also your optic nerve. Okay, I'm not seeing any detachment. That's perfect. I'm gonna go ahead and do the same thing on the other side. So please look behind me at the wall. Okay, perfect. I'm going to check you for a color deficiency now. Can you please tell me what number this is? 6, great. And what number is this? 8, good. And what number do you see here? 5. And what about this one? 7. Excellent. What about here? 3, good. And what about this one? 7, good. And what about this one? 73, great. And now I'm just gonna go ahead over here. Can you please trace from this X to this X with your finger? I'm just gonna go ahead and bring it closer. Wonderful. Okay. Now I'm going to check your peripheral vision. I'm going to ask you to distinguish this color. Can you please tell me what color this is? Red, good. And what color is this? Green, perfect. So I'm going to ask you to follow the red ball only with your eyes and don't move your head. Okay? So let's go ahead and begin. Okay, so don't look at the green ball, only at the red ball. Good. Okay. Good. And now we're going to go ahead and switch. Look at the green ball only, and don't let yourself distracted by the red ball. Good. Perfect. Excellent. Okay, I'm not noticing any deviations there. Can you please look at my fingers right here? Perfect. And now look at my fingers right here. Excellent. Can you please tell me which fingers are moving, right or left? Good. Good. Perfect. Excellent. Wonderful. Very good. 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 Now go ahead and look straight at my nose. Give me 1 second. Look straight at my nose. Good. Go ahead and look at my nose again. Wonderful. So I'm going to ask you to follow the light with your eyes only. Don't move your head. Okay. Good. Just look at the light. Excellent. Good. Keep on looking at the light. Don't let yourself distracted by the sounds around you. Good. And I'm just gonna go ahead and check your pupil size. I would say you are about 3 millimeters in both eyes. Good. Are you experiencing any hearing loss? Okay, wonderful. So I'm gonna go ahead and create a vibration sound. I'll put it behind your ear on your mastoid bone. Please tell me when you don't hear the sound anymore. Now, good. What about now? On this side. Now, perfect. And now I'm going to ask you to tell me which sound here is louder, position number 1 or position number 2. Okay? So this is position number 1. And this is position number 2. Number 2. Perfect. Same thing on the other side. This is position number 1. And this is position number 2. Number 2. Excellent. Let's go ahead and check your ears. Okay. I'm going to ask you to look that way for me, please. Okay. Great. Tympanic membrane is pearl gray. Let's go ahead and check your other side. Okay. Tympanic membrane is intact. I'm not noticing any vibrations. Okay, so no signs of any fluid built up. I'm gonna go ahead and check your reflexes next. Can you please relax your jaw for me? Okay, just relax it just like this. Great. Good. And I'm gonna go ahead and move down. Good. 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 And your knees. Good. Good. I'm not seeing anything abnormal. Let's go ahead and check your muscles on your face. Can you please give me a big smile? Just like this. Just do whatever I do. And now go ahead and frown. Good. And puff your cheeks. Keep them puffed for me, please. Good. Can you please close your eyes? I'm going to try to open them. Don't let me do that. Okay. And I'll go ahead and open your eyes as wide as you can. Just like that. Good. I'm going to try to close them. Good. And now can you please lift your eyebrows up? Good. 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 Okay. So I'm noticing that you cannot smile equally on both sides, and this side is a little bit higher than the left side, definitely. And when I did ask you about the facial sensation, when I did the examination, it seemed like you mixed them up a little bit, and it was more on the left side than the right side. So I'm guessing that your nerves are a little bit damaged, at least nerve number 5 and number 3. So I'm gonna have you do a repeat CT scan. I know that you did the same CT scan in the ER, but I'm just gonna ask you to repeat it. Is that okay? I know it's very expensive here, but I think we do have some financial aid possibilities, and we're just gonna ask you to apply for it. Okay? Okay, let's go ahead and continue, please. Can you please squeeze my fingers as hard as you can? Good. And now I'm going to ask you to extend your hands and your arms just like this in front of me. Great. So what I'm going to do is I'm going to push down on your arms. I'm going to ask you to resist, and don't let me do that, okay? Good. And now I'm going to ask you to keep your arms like that. I'm going to ask you to hold them straight, and I'm going to try to open them. Don't let me do that. Good. And now I'm going to try to close them. Don't let me do that. Good. All right, so I'm going to do the same thing with your feet, okay? So just relax there. Oh, let's go ahead and just relax your feet and your legs. Good. All right, so now they're relaxed. I'm going to ask you to lift up your left knee. Okay. And now lift up your right knee. Wonderful. All right, so let's go ahead and discuss the results. I'm going to write a prescription for gabapentin. Gabapentin, 200 milligrams twice a day, one time in the morning, one time at night, okay? And that should do the deed. Let's see, what do we have here? Okay, wonderful. So just go ahead and take this prescription with you and let me know if you're experiencing any side effects. Sounds good? All right. It was very nice to meet you. Thank you so much for coming in. I'll see you back soon. Take care.